All right, it is October, and as you may know by now, that means Breast Cancer Awareness Month. And we're going to talk a little bit about an aspect of that. That is to say, the procedure called a mammogram, which is key in the diagnosing of breast cancer. And to talk about that is Lisa Schering. She's an RN at the Borgess Breast Center. In fact, she is a Imaging Patient Navigator, which sounds like an impressive title. Lisa, good morning.
Good morning, Richard.
Thanks very much for the time today.
You are welcome.
So you are in the practice of, as a patient navigator, it sounds like, helping folks navigate this system.
That's correct. I meet women when they have an abnormal mammogram.
Okay.
And then I move them through additional imaging and a possible biopsy and a possible cancer diagnosis.
Okay. But I guess we're getting ahead of ourselves,
yes.
aren't we? So let's start with the mammogram. It is still the key way of a diagnosis, right, or not getting one.
That's correct. Mammography screening is the best tool that we have to diagnose breast cancers.
Mm-hmm.
It's good in that it is readily available. Every woman should have access to it, and it's relatively less expensive than our other procedures, and it's very reliable.
So what is a mammogram?
A mammogram is an X-ray of breasts. It's, would you like to know how a mammogram is done?
Yeah, let's talk about that.
Okay. So to get this X-ray of the breast, the woman has her breast placed on a plate, then a compression plate comes down, and a brief exposure to X-ray is made. We do that from the top to bottom in a side-to-side view,
Mm-hmm.
and then it creates a digital image that a radiologist then can interpret and look for changes by comparing it to their previous mammograms.
I see. All right, and in a minute, we'll talk about what it means if you're starting with the first mammogram you've ever had, and I presume that ends up being the benchmark, and we'll discuss that coming up in just a moment on WBCK. 8:13. We're talking about mammograms this half hour here as part of Breast Cancer Awareness Month, and Lisa Schering is a registered nurse at the Borgess Breast Center. So, yes, if you've had that mammogram done and it is your first one, Lisa, you're saying that one is going to be the benchmark for future comparisons. Is that true?
That's right. A significant key to mammography is comparing from year to year. So you have this first mammogram, you will be greeted by one of our lovely technologists that have been doing breast imaging for years, and they will walk you through the procedure. We want you to feel very comfortable with this procedure, and it's not unusual with your first mammogram to get a call inviting you to come back for more mammogram images because we don't have anything to compare it with. So we would encourage you to come back at a different appointment where we would focus in on some questionable areas, and then you would leave with an understanding of this mammogram. Then next year when your mammogram is due, you'll have the new mammogram done. The radiologist will pull up that old mammogram and compare them and look for changes.
What kind of changes would that person be looking for?
Well, the radiologists are trained specifically in breast imaging, and they can recognize subtle changes in it. If it's maybe the start of a small, dense area, they can see that. We can potentially see things 2 years before you can even feel them.
Oh, my.
They're looking for what we call calcifications. It's another tiny thing that you can see on the mammography, again, that's not noticed by the woman. That's typically what they're looking for.
Mm-hmm. You know, I've heard two things. I've heard some women say that it was discovered, as you describe here, by way of the mammogram. I also have another friend who said, I just didn't feel right.
Okay, that's interesting.
And the mammogram revealed that she was correct. And so it sounds like, though, that's an unusual set of circumstances.
That is an unusual set of circumstances. However, I have seen and heard all kinds of stories, like my cat jumped on my breast and I felt something strange.
Uh-huh.
Well, that's just a little tap on the shoulder that you need to get a mammogram, or little reminders like that where all of a sudden your attention is drawn to your breast and you think, and it may be something totally non-concerning, but it got you in for that mammogram.
Right. Are there people who, based on the description of what you described, or maybe past experiences of having a mammogram, who say, gosh, I just don't like that and I don't want to do it? And what do you usually say to them?
I say, I can appreciate if it's uncomfortable for you, but the brief bit of uncomfortable is so worth it. Be confident that, again, our technologists are excellent. They will work you through this procedure and make you as comfortable as possible. So don't let that be something that stops you from getting your mammogram.
Mm-hmm. And I presume still the key here is early detection if it's there.
Absolutely. Those breast cancers found early are much more treatable. They are less likely to have spread outside of the breast. Most often it's a lumpectomy that the woman would have, simply removing the area of concern out of the breast, as opposed to a mastectomy, having the whole breast removed. So there is much value in finding breast cancers early.
Lisa Schering is with us, a registered nurse with the Borgess Breast Center. We're talking about mammograms. So in a moment, we'll talk about who really needs to get a mammogram. Is it a certain age group? Does it not matter? We'll find out coming up in just a moment. All right. We've been talking here in Breast Cancer Awareness Month, 6 days into it, about mammograms. Lisa Schering is an RN at Borgess Breast Center. So we've been talking about mammograms and that ladies should get them and do so regularly. But who really needs one, Lisa?
The recommendation is that every woman over the age of 40 have a mammogram every year. And I can talk about that a little.
Yeah.
The number one risk factor for breast cancer is simply having breasts. So if you're a woman and you have breasts, boom, you have the number one risk factor.
Mm-hmm.
The number two risk factor is getting older. So if you're getting older every day, you need a breast mammogram screening every year. And then we look at things like family history. Mammography younger than 40, the breasts are still quite glandular and affected by hormones that it's difficult to get a good mammogram image.
Oh.
So that's why they set it at age 40 and beyond. And you only stop mammography when you are no longer in good health and can't make it here.
Mm-hmm. Wow.
So
Boy.
you do not stop mammography until you're that point.
Okay. And as you say, as we get older, the risk increases. Haven't met anybody that isn't getting older.
Exactly.
Right. So that there really is a small group that you don't want to see yet.
That's correct. We want to see all you precious women over the age of 40.
Mm-hmm. How can women request one? Do they have to have a referral from a doctor, or can they just make an appointment?
Well, ideally, contact your physician's office and go through your physician, because then your physician will get a report, and if any follow-up is needed, that will be orchestrated. You'll have a physician there to follow you through. If you do not have a physician, I would suggest that you contact your county. The county programs have cancer programs designed specifically for breast and cervical cancer detection. Komen, I just read a great article from Komen that please contact Komen if you have difficulty getting a mammogram. But you certainly can get a screening mammogram without a physician's order.
Okay. What about money, Lisa? I mean, are there some people you meet who say, I just can't afford to have that done?
Well, with the Affordable Health Care Act, most health insurance cover the screening mammogram. So there shouldn't be an issue of covering the cost for a screening mammogram. Now, if your screening mammogram shows a question and you need to have some more mammography and possible breast ultrasound, then there can be some cost to you. That's something that you would discuss with your health insurance. But then don't let that stop you if you are in a position where you can't afford your deductible. We have resources available that we try to offer to everyone. We've got Tree of Love at Borgess, which is people in the community who have donated their money because of their commitment to helping women with breast concerns. There are the Komen funds. There are county funds. So it may take a little work and making some phone calls and being persistent, but please do not let the cost stop you from completing your mammography.
Mm-hmm. So if someone has had a breast cancer diagnosis, let's say they've had a lumpectomy, at what point do they resume getting mammograms?
Well, that's under the direction of their oncology team, but certainly the next year for sure, if not 6 months after treatment. Because you have the other breast that you have to monitor, and you've got the remaining breast tissue, and the fact that you've had a breast cancer diagnosis, that adds another risk factor. So, unfortunately, there are women who get breast cancer a second time. It's not often, but you do continue to need to be screened annually.
All right. And so if there's any message we're giving here as we part ways with you, it is go ahead and get it.
Yeah, get your mammogram. We're a great group of women here. We enjoy our patients. We feel good about what we do. We've got excellent radiologists reading our images. We will make it a positive experience for you.
Well, and that's a terrific place to end, and I think that comes through in the sound of your voice, and we appreciate that.
You are welcome.
Thanks very much. Lisa Schering is an RN with the Borgess Breast Center. And, well, here at Breast Cancer Awareness Month, it's time to consider making that mammogram appointment and get it done.